Post-COVID patients make a full recovery, but millions of Americans still face long-term issues that go way beyond flu-like symptoms. Good morning. It is Thursday, February 23rd. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we hear from one COVID long hauler who has lived for more than a year with a variety of symptoms, and talk with a doctor helping people like her navigate their long-term recovery. Long COVID symptoms are still impacting millions of Americans, according to the CDC's Household Pulse survey. As of January 16th, 15% of all adults in the U.S. reported having long COVID at some point in time. 6% said they were currently having long COVID symptoms now. That's 1 in 17 adults, an estimated 15 million people reporting long COVID symptoms as of last month. And today we are joined by someone who knows what those long haulers go through. Dr. Brandon Comfort is here. He's an internal medicine specialist, having helped patients in the post-COVID clinic during the height of COVID. How are you today?
I'm doing well, thank you.
Good to see you. And joining us virtually is Michaela Dreyer, whose COVID infection triggered a whole host of problems. Good morning, Michaela. Before we check in with how she's doing, Alexis Del Cid helps us understand what Michaela has been through since December of 2020. In an installment of Where Are They Now?
I'm just not much of a sit around and do nothing kind of person.
At 29 years old, Michaela Dreyer was enjoying an incredibly active life.
I was a long distance runner, so I like to do 5Ks, 10Ks, and even half marathons.
When the pandemic hit in March of 2020, she was also in the process of becoming a mom to 2 small children.
I was hypervigilant from the start.
Then one day at the end of December, she woke up with a tickle in her throat, and we all know how this next part goes. The tickle became a cough, the cough became a fever, add in a racing heart. Then Michaela lost her sense of taste. She got tested COVID positive. Michaela's fever took 21 days to break. After that, she had trouble breathing, walking, sitting, talking. It was terrifying.
I was 29 years old. I'd never had to be afraid that I might not wake up in the morning because I wasn't going to breathe.
Days turned to weeks, weeks turned to months, and the symptoms multiplied, now including chest pain, fatigue, muscle weakness, and tremors causing her to lose her grip and drop things constantly.
I knew I had COVID, but I didn't know why I was having all of these symptoms.
After 5 months of suffering, Michaela got a referral to the University of Kansas Health System's post-COVID clinic, a special clinic for long haulers, where she finally didn't feel like such a medical mystery.
Everything I described, they had heard it before.
And she finally got a diagnosis. Michaela was diagnosed with something called postural orthostatic tachycardia syndrome. It's a mouthful, and it's most commonly known as POTS. Doctors say typically they see someone with POTS who has suffered a traumatic injury, something like a brain injury, meningitis, even pregnancy. But now more and more often, they're seeing it in their COVID patients. While under the care of post-COVID specialists, Michaela developed more alarming symptoms: numbness in her hands and feet, and dizzy spells so severe she had to rely on a wheelchair. But at least she had doctors who told her they knew why it was happening, and they had a plan to get her on a path to recovery. And equally important, they gave Michaela validation at a time she was feeling as if she was coming unmoored.
I felt heard, and that was really, really big.
Michaela, it's so good to see you this morning doing well, because after many hours of physical therapy, your condition did gradually improve, but then something very exciting happened to you. You got pregnant in early 2022. Tell us what happened.
So I found out I was pregnant in the middle of February, so about this time last year. And within about 3 weeks, I noticed that I was not having the same symptoms that I had been having for the last year since my COVID diagnosis. And I thought that was a little bit weird. As I started my pregnancy, I was in the high-risk pregnancy clinic because of my post-COVID issues and my blood pressure difficulties, et cetera, et cetera. But within the first 10 weeks of pregnancy, everything just kind of leveled out. The OB kind of explained it as when you are pregnant, your blood volume doubles, and that increase in blood volume helps to keep things moving in a way that my body was struggling to do prior to pregnancy, but post-COVID.
Well, congratulations on the pregnancy and the new healthy baby. We're very excited. That's a really great "where are they now" story. That's what we like to hear.
Sure.
So after you gave birth, were you still experiencing, less symptoms, or did they start to creep back? Tell us how you're feeling.
So that's a good question. So throughout my pregnancy, I ended up, after my first trimester, I ended up just being switched to the regular OB because my symptoms were pretty much non-existent, and that continued throughout the pregnancy. I delivered in October, and in the first couple of weeks after that, I had a couple of symptoms come back up for maybe a day or two, but now here we are 4 months postpartum, and for the most part, I would say I only have I would say I have a pretty typical postpartum recovery, and I would not know that I have any other diagnoses other than the fact that I'm on medication. So it's been pretty incredible. Yeah.
Yeah, that baby did a body good. I love it.
Sure.
I love it.
That's exactly what the cardiologist at KU had kind of told me. He monitored me throughout the pregnancy and said, sometimes this might happen, and you kind of have to wait until after that 4th trimester, so about 3 months postpartum, to kind of decide, or for you to be able to see, did the body really recover well on its own, and did pregnancy act as sort of a reset for the autonomic nervous system? And so now we've reached beyond that point, and other than a couple of rougher days in that first 2 months, I think things are going very well. So
Dr. Comfort, when I heard the story, I thought, that is so cool. And Michaela explained it a little bit, what her OBGYN had said about the increased blood volume, but kind of dive into that a little bit more for us. Help us understand how that all worked out in her favor.
For sure. Well, first of all, so glad you're doing well, Michaela. Congratulations on the baby, and we're so happy you're feeling well several months later. And when we think about POTS, we think about primarily as an autonomic nervous system problem. So that part of the nervous system that we don't have to think about, that controls our heart rate, our blood pressure, or whether we sweat or not, or something like that. But also a feature of people who have POTS is that they have lower blood volume. And so, as Michaela mentioned, when you get pregnant, your blood volume goes up 40, 50%, sometimes even doubling. And so we think that that kind of counteracts some of the effects that people who suffer from POTS have.
So then talk to us about the connection between COVID and POTS, and the difference between, like, POTS. Is POTS the same as long COVID? What's the difference there? And then can COVID actually trigger POTS to happen?
Yeah, great question. So they're two different things. So, POTS has been around or been described for a long time. We've seen this. I've had several patients in my primary care practice, for example, that had POTS before COVID. And so oftentimes this is triggered by other viral infections, influenza, other cold viruses, trauma. People who are bedridden for a prolonged period of time can develop POTS. What we saw, though, during the COVID pandemic, during the height of it, is that there were a lot of people developing POTS. And so COVID is just one additional thing that can trigger POTS, basically.
Yeah, leave it to COVID to help us learn of something I'd never heard of as POTS. I think that was something new to a lot of us. And then talk to us, the P in POTS is for postural, like posture. So what is it about posture that can cause problems?
So our bodies are smart, right? So, when I stand up, gravity is going to try to pull my blood volume down. And I think they say about, 500 milliliters or so of fluid will kind of drop. But, we got to keep blood up into our head. And so our body has these reflexes put in place where it'll constrict our blood vessels to keep blood in our head. But also it'll increase our heart rate to increase that cardiac output to ensure that we have enough blood in our head. And so, for me, someone who doesn't suffer from POTS, my heart rate may go from 70 to 80 when I stand up. But for people who suffer from POTS, we've seen it go from 70 to 140 or higher, and so when that heart is really pounding away, it leads to a lot of these symptoms that Michaela was describing: lightheadedness, dizziness, fatigue, etc. Yeah,
when you explain it, it all makes sense. Michaela, tell us what some of the worst symptoms that you had. What do you remember most? Did you pass out? Dr. Comfort explaining some of these things that would have been really scary if you didn't know what you had. But what do you remember most that really concerned you?
So the worst time for me was the summer of 2021. So that was about 6 months after my initial infection, and I used a wheelchair for a month at that time because my dizziness was so difficult to manage. And so, like Dr. Comfort was saying, when you stand up, if you have POTS, your heart rate can go from 70 or something, and mine was shooting up into the 160s, 170s, sometimes even faster than that. And the blood was not catching up to my head or getting up to my head fast enough. And so I'd become super dizzy and unstable and start to pass out. And so getting up and down all day long when you're going from sitting to standing or laying to standing, et cetera, just led to so much instability that using a wheelchair when I was outside of the home became the best way to prevent me from passing out. Taking showers where I was standing for a long period of time, particularly in a hot environment, was also super triggering for that those blood pressure issues. And so I passed out in the shower a couple of times as well, which was super scary for all the obvious reasons. And there were the most difficult parts were earliest on when I was having chest pains to go along with all these symptoms, and I didn't understand what was going on. I could tell it was but we didn't know exactly what was happening, and it was my blood pressure, and the medications ended up helping with that. But when you're 29, 30 years old and having chest pains and difficulty breathing, and you're not able to stand up for more than like a few minutes without passing out, it gets very scary very fast.
Yeah, you're on beta blocker to help control your heart rate and your blood pressure, but you're also doing a lot of physical therapy. Talk about the physical therapy.
So I did physical therapy from June through August. So what's that, 3-4 months? I was doing physical therapy in the office twice a week. So it was relatively intensive now that I look back on it. Throughout the summer, and we basically started in a totally supine position, laying down and trying to just reteach my body that it's okay for my heart rate to elevate without having my autonomic nervous system to go completely haywire. So we would try to elevate my heart rate through exercise, but while laying down, and try to keep things managed and the symptoms managed. And then gradually, as that improved, then we started doing exercises while sitting up to kind of do the same thing. And then eventually we got to the point where we were standing up and doing exercises, and my body was able to better tolerate being in different positions, and my heart rate would still be able to stay stable, and my blood pressure would be able to stay stable. And all of those things led to appropriate blood flow and not passing out. So
Dr. Comfort, tell me, why is physical therapy so important for these type of patients?
Oh, it's critical. Yeah. So I mean, our therapists they do all the hard work, and they do the most important work, both for our POTS patients, but also for long COVID patients. There's a lot of overlap with that, and so, it's easy to get deconditioned when you feel this way, right? You don't want to be active and those sorts of things.
Yeah.
Our therapists can work with patients. They can do it in a very systematic way to get them back to their functional status. So they're absolutely critical in this.
Is POTS a lifelong chronic problem for someone, or will it just go away?
Yeah, that's a good question. So about half of people actually just goes away spontaneously, whether we do anything or not, right? These things can help people get through that recovery quicker, but lots of people do improve. There is still a large percent of people who suffer from POTS long term, or it'll kind of come and go a little bit intermittently throughout their life.
Dr. Comfort, I saw you a bunch at the beginning of the pandemic, and as people were being treated in our post-COVID clinic. You're seeing fewer patients, which is good news, but tell us a little bit about how the COVID clinic came to be and kind of how it's evolved.
Yeah, so it was always intended to try to meet the need of the community, and we saw that there was a large number of patients suffering from long COVID, and so we set up a clinic or kind of a workflow to get patients access into those services. So it came into our clinic, and then we would try to kind of get people connected to our various specialists here at our hospital. As time went on, I mean, the need became very, very large, and so we needed more help. And so the workflow now is that we've really kind of split this into a clinical pathway and into a research pathway. And so we've relied on our primary care clinics here at KU, which is growing every day, and we want have patients get connected into our primary care clinics, and then they get connected to pulmonary, or Michaela's case with cardiology and other clinics like that. And then we got the research angle. So this is clearly something that we need to learn a lot about, and there's a lot of active research going on. Dr. Castro is the PI here at KU for the RECOVER trial, which is a large across the country, multi-center trial looking at patients who have long COVID, all to try to find out, learn more about this with the hope of having better interventions over time.
So not all long COVID patients are POTS patients, we know, but what other symptoms have we learned? Anything new that long COVID patients are facing?
Yeah, so most commonly, long COVID patients, fatigue is the number one thing that we hear, and it's a very debilitating fatigue. I mean, people can't get out and to go work or take care of their kids.
And is that acute up front, or are they still experiencing
many people
that
experience
1-2 years out?
Usually, so most people's long COVID symptoms get better within a year.
Okay.
6 months to 12 months or so for the majority, but there's that small percent of people that are suffering for a couple of years or more. At this stage, we don't know how long that's going to go, but it can be for several years. So fatigue's a big one, shortness of breath, cough, ongoing pulmonary. When in our system, and we've done studies on our own patients, it's a huge percentage starting from brain fog and other cognitive deficits. And so that's been a really big one that has really hit people. And it can affect basically every system of the body, though. So we see rashes, we see ongoing loss of taste and smell, we see, you name it, chest pain, joint pains, all of it. And so.
Michaela, what's next for your health journey? I know you eventually want to get off those beta blockers, right?
Yeah. So right now, the plan with the beta blockers has been obviously to maintain those throughout the pregnancy. And now that I've delivered and I have a healthy baby, my blood pressure and heart rate have both been at a pretty baseline normal. And so at my next follow-up visit with the cardiologist, we'll start talking about trying to wean off and essentially see what happens. Like I've said, my symptoms have pretty well disappeared, but I am on the medication. So it's possible that without those medications, I might have some symptoms return, in which case we would just add them back in. But hopefully, whether it's with or without meds, I'll just be able to continue to make progress, healing from birth, and then getting back to an active life, and I'm able to start that very gradually, of course, but I've been able to do yoga again, which is something I really loved doing before COVID, but I couldn't do when I had POTS at the peak of it, because obviously there's a lot of postural changes in while you're doing yoga, and that would trigger, as soon as I would go to my first downward dog, I would start to get lightheaded and need to stop. But I've been able to do yoga since the middle of my pregnancy, and have been able to do a little bit here since then. I really need to get back into doing it more because I can. So now I'm just kind of figuring out what it looks like to return to a somewhat normal life. And obviously being so grateful that these changes have come with pregnancy, even though that was not necessarily a guarantee, because pregnancy certainly doesn't reset for everybody who has POTS. But I was a lucky one, and I'm really excited to be able to kind of see what else my body can do again now that I have mostly recovered.
Well, make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network for Dr. Comfort and Michaela. You can find links to those right there on your screen. Let's get a quick check on our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. How are you?
Yeah. Hi. Good.
Hi. Hey.
Right now in the hospital, 27 actives, so 52 total, 27 actives, still a high proportion in the ICU with 5 in the ICU, 3 of those on the ventilator as well. So unfortunately, numbers are still holding steady in that mid-20s. We certainly would like it to go down. We've had a low peak, I think, long over a year ago. Would still be appreciative if that happens, but right now our numbers have really been steady in those mid-20s for active infections that we are treating and managing.
All right, I want to bring you into this long COVID conversation. There was a headline that we saw yesterday. Forbes reports more than half of long COVID patients suffer from organ damage up to 1 year after COVID infection. That's based on a new study in the Journal of the Royal Society of Medicine. The study found that 1 year after a COVID infection, 59% of long COVID patients had mild damage to organs like heart, liver, and kidneys. What do you make of that?
Yeah, I think that's important to note. I think we've talked about the symptoms, long COVID symptoms, so what you're feeling. We've seen good data to support that, by 6 months to a year, and Dr. Comfort talked about this, really we are having a resolution of those symptoms for many, many people. But when you look at maybe the organs like the liver, where we can do some blood tests to look at that damage, or the kidneys, or even the heart, you may still have some maybe non-symptomatic or non-clinical evidence of disease or damage, but looking at that, we know that it's still happening. So it is very important. We are still learning about this disease in the acute sense, but also the long term.
Dr. Kupfer, what are your thoughts on that? Just that headline and what it tells us, everything that you've been learning so far?
Yeah, not terribly surprising, honestly, and kind of scary if you think about it. But I think it's another layer that we're learning about this. I think we really have to understand the biological mechanisms of this disease. This adds to that, and then hopefully over time that leads to targeted treatments. Right now we're really relying on physical therapy, occupational therapy, other kind of symptom-based treatments, like what Michaela was getting and things like that. But we really want a targeted treatment going after that biological mechanism.
All right, let's see if we have any reporters on the line. Let's get to our community questions today. So Marcy wants to know, how do you know if you have POTS and that it might not be something else?
Yeah, it's a good question. So, the symptoms, Michaela highlighted those really, really well, right? So you may feel dizzy, you may feel lightheaded, you may feel your heart kind of pounding out of your chest. It just feels like that. If you're having those symptoms, what I would do is go to your primary care doctor. The first thing they're going to do in the clinic is they're going to check your orthostatic vital signs. So they're going to have you lay down and check your blood pressure and your heart rate, and they're going to have you sit up and they're going to have you stand up. And that alone can give us a pretty good indication of whether or not somebody has POTS. If that's negative or something like that, then we can kind of start looking into other things. But if you're having any of those symptoms, contact your primary care physician.
Katie wants to know, could POTS lead to a heart attack?
No.
No,
it's a totally different mechanism, and so there's really no increased mortality or with people with POTS. It's certainly debilitating, but it doesn't lead to a heart attack.
Okay, Yvonne wants to know, Michaela, did anyone not believe you or not understand your POTS? I think you mentioned that was the case. I know you were thrilled when somebody finally did believe you, but what was it like trying to explain this to people?
So in the, this is, about a year after the pandemic started. And so people were just starting to talk about having these symptoms longer term, and what it would look like. And all of the focus at the time was on people who were, immunocompromised, or maybe people who were already older, had some other kind of health issue that predisposed them to something else. But that wasn't me. I was 29, 30 years old, perfectly healthy, and then all of a sudden using a wheelchair. And I got a lot of looks from people who didn't understand. And maybe they weren't actively not believing, but they were certainly not understanding, because you looked at me and I didn't have a broken leg or something. And sometimes people don't understand that invisible disabilities can still be disabling in such a way that you might need a mobility aid. And that was more in like the general public sense. I was very lucky that the doctors at KU did not have, or they always believed my symptoms, and it took a little while to figure out exactly what they were pointing to. Just a couple of months, honestly. It's not a long time in the grand scheme of things. But in general, people would often say, oh, you're having chest pains. Maybe you're just anxious because this pandemic is so stressful, or, something to that effect. And they would really struggle to understand just how difficult it might be to not know if every time I stand up is my heart rate going to skyrocket and am I going to pass out. And when you think about the number of times as an active person when you're moving your body during the day, and how many times you have to think about that, and for them to really wonder, oh no, is that really actually truly happening, or is she being dramatic, et cetera, et cetera. And I think it took me actually passing out for people at work, to be like, oh, okay. No, if she said she needs the wheelchair, that's probably a good idea. Just to keep her sitting down so she's not changing positions and we don't have to worry about somebody passing out. So.
And Dr. Comfort, I mean, I'm sure that sounds like a familiar story as far as what you were hearing from patients during the pandemic who were suffering from these really unusual long COVID symptoms.
Yeah.
What was that like hearing them and being the one who believed them?
Yeah, it's really hard. You know, I think many people face that exact same thing that Michaela was describing, and sometimes it's hard, when you can't see something. So those invisible disabilities, I thought was really well said, and so it's heartbreaking. But I think there has been a really good concerted effort to educate the public. This has really been patient driven, by the way. So there's been a lot of strong advocacy from patients who suffer from long COVID. And it's really got the word out. It's got the media attention and things that it needs.
Yes, Michaela, thank you for being so open and sharing and educating, as you said. Anything else cause POTS other than COVID? Because it's been around.
Yeah, it's been around. Other viral infections are
Okay.
probably the thing we think of first, but really any condition that puts somebody in bed for a long time. So if critical illness, people who are in the hospital for a long time, we see it kind of that set up POTS as well.
All right, let's get final thoughts from our guest today. Michaela, I'm going to bump it back to you. Final thoughts, what should we know?
I just want to say, here's a keep me now by my baby. I just wanted to say, I got lucky in that my POTS symptoms have really well recovered, partially due to pregnancy, but that's not necessarily the case for everybody. And so I don't want people to treat COVID as less of a serious issue just because some people recover well or pregnancy happened to be a good thing for my symptoms. And I just want to encourage people to reach out to doctors when they're having concerning symptoms, especially after COVID, and let them help you navigate it. The team at KU has been fantastic in doing that and believing what patients are going through and then helping them find appropriate interventions to get back onto the path to recovery as quickly as possible.
Okay, cute baby alert. You can't pull that little one in and not give me a quick update stat. I want to know all the details real quick.
This is August. He is just over 4 months old now, and he's a pretty happy baby. And he is, we went to the pediatrician just last week, and he was like 13.5 pounds. He's a little small because he actually got sick a couple of times already in the first 4 months just with regular bronchiolitis colds. He has not had COVID, and he was in the hospital. So he's just working on a growth spurt right now to catch back up. But he's doing perfect. So
he is perfect.
Charm.
And he is. He's the lucky charm. And I'm just so glad that you're feeling better so you have the energy to run around after him.
Yes. Thank you so much.
Again, Michaela, thank you for sharing your story. And we'll see you soon. Stay in touch.
Thank you.
Dr.
Will
Tucker,
do.
final thoughts.
It's pretty hard to follow August.
It really is. I'm sorry to do that to you.
I know, that is tough. But, I'm just so happy that Michaela's doing well. I know this has been a long journey and just so appreciative of her sharing her story with everybody because this is how we get the word out and it helps. I mean, this is going to help a lot of other patients. And also just kudos to her team. So to be fair, I was not part of her medical team, so I'm not bragging on myself here, but she had just an amazing team here. I know the cardiology group worked really well, the therapists and others. And so just a really nice job all the way around to teamwork.
And
here.
nothing better than seeing somebody like Michaela down as she was, fatigued, sick, in a wheelchair, holding August and doing life again.
Oh my gosh, no kidding.
All right, Dr. Hawkinson, final thoughts.
Yeah, I mean, cuteness overload, right? You need to put August or Augie in your pocket and take them with you for good luck, really. No, I agree. I think, we have heard about long COVID persisting and being a health crisis. It certainly is. It affects so many people. Luckily, there is some sort of light at the end of the tunnel for most people. They should recover, but the best thing also is that we know the NIH, the U.S. government, has put a lot of funding into research about the mechanisms, but also about potential therapies for that as well. So just encourage people to continue to seek out that medical help. Right now, get that symptomatic therapy. And again, for most people, there will probably be some improvement or resolution of those symptoms, but I know on a day-to-day basis, it definitely is difficult.
Thank you to all of our guests today. All Things Heart is coming up at 10 a.m. this morning. Alexis Del-Cid joins us with a preview. Good morning.
Good morning, Jess. This morning, you're going to meet a woman named Kathy who survived an epic journey. And talk about intense. She survived cancer, life-changing surgery, and then a heart transplant. So how in the world do you say thank you when you get a gift like that? Well, she's doing her best.
There's no way to say thank you. How do you say thank you? for receiving a donor's heart.
You're going to hear her beautiful message to the donor family, along with everything she endured before receiving that gift of life. And you'll hear from the doctor here who guided her every step of the way. That's coming up this morning at 10 a.m. We'll see you then.
All right, Alexis, another great episode. Thank you. And thanks to everyone watching today. We will see you back here tomorrow. Have a great day. Coming up tomorrow on the Morning Medical Update, a decade of debilitating pain gone. I'm Jessica Lovell. On the next Morning Medical Update, what one woman assumed was her bad back was actually something way worse. The surgery that she says made her feel 20 years younger. That's Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.